Bonjour tout le monde, bonne année.
Hello everyone and Happy New Year. It is the start of a new year, and I know many Canadians are waiting to see what 2021 has in store. We are still far away from the end of the pandemic, but I would like to start today by saying that we do have reasons to be optimistic. 2 safe and effective vaccines have been approved in Canada, and we have already started receiving doses of these vaccines over the last few weeks. Our government has worked tirelessly to deliver nearly 500,000 doses of these vaccines to the provinces and territories last month, and these efforts will continue. These vaccines will protect Canadians and save lives. That is why it is essential that the provinces and territories carry out their vaccination campaigns as quickly as possible. The federal government will pay for the vaccines and the necessary equipment to administer them. And through the National Operations Centre, supported by the Canadian Armed Forces, we will enable the vaccine distribution efforts to be coordinated throughout Canada.
COVID-19 vaccines just a few weeks ago, we've already delivered nearly 500,000 doses to the provinces and territories. We're on track to have well over 1 million vaccine doses from Pfizer and Moderna by the end of January. And by September, we'll have enough doses to vaccinate every Canadian who wants a shot. This pandemic will end. We will get through this. Better days are on the horizon, but to get there, we need to keep holding on. Je l'ai dit et je le répète.
I've said it before, and I'll say it again. This is not the time to vacation abroad. We need to hold on and be strong. And I would like to discuss the Canada Recovery Sickness Benefit. The goal of this benefit is simple: to enable workers to take paid sick leave if their employer doesn't offer it. For example, this benefit is for a grocery worker who needs to quarantine because they entered into contact with a colleague who tested positive, or if the grocery worker themselves has symptoms. That way, the person doesn't have to choose between losing income and protecting others by quarantining. The objective was never to send a check to those who decided to go on vacation at a time like this. My message to those who have traveled in countries in the South is clear. You will not receive this benefit. It was not prepared for you. For those who are upset reading the reporting over the weekend, I share that frustration and anger. We are correcting the situation quickly. I know you have made many sacrifices. What we need to remember for now is that those who are traveling for non-essential reasons will not be able to access the Canada Recovery Sickness Benefit. Since March, we have been telling Canadians to avoid all non-essential travel, and we are continuing to repeat that message. There is also a mandatory quarantine for all those who return to Canada without exception, with very severe legal restrictions if the quarantine is violated. The checks and measures that we have placed at the border since March are some of the strictest in the world. That's important in order to protect our loved ones, health workers, and to ensure that our hospitals not be overwhelmed.
Has long had some of the strongest travel measures in the world. Since March, these rules have helped save lives. As new strains of COVID-19 emerge, as cases skyrocket in countless countries, this is the time to double down on keeping you and your family safe. Starting Thursday, to be eligible to return to Canada, travelers must have a negative COVID-19 test before boarding their flight. This is in addition to the long-standing mandatory 2-week quarantine once people arrive. Officials are reviewing travelers' isolation plans, and if the plan is not up to par, the travelers will have to quarantine in a federal facility. Earlier today, I also spoke with President Ramaphosa of South Africa, including about our work together on fighting COVID-19 and the global response to this pandemic. Canada and South Africa have long worked as partners to keep our citizens safe and build a healthier, brighter future for everyone. As we face this pandemic, we will continue to stand together. This includes on fighting the virus and on ensuring that no one gets left behind as we rebuild. On public health in particular, Canada is taking the steps needed to protect Canadians and stop the spread of COVID-19. We've put in place additional screening and enhanced measures to respond to new challenges wherever they occur around the world. We've been very clear. No one should be vacationing abroad right now. But if you still decide to travel at your own risk, you will need to show a negative COVID-19 test before you return, and you must self-isolate for 2 weeks when you get back. You need to take this seriously. Not following the rules could mean real consequences, including fines and prison time. Let me also be very clear about the Canada Recovery Sickness Benefit. It is not intended for travelers who are quarantining when they return from holiday. This program was created to give people sick leave if they needed it and otherwise wouldn't have one from their employer. It's not there to pay for someone's post-vacation quarantine. We'll have more details soon, but anyone who traveled for non-essential reasons will not be able to access the sickness benefit. So many people gave up so much more than just a vacation over the holidays. There's a reason so many Canadians made those tough but responsible decisions. There's a reason so many Canadians did their part. It was for the people around them, for the senior that is better protected, for the frontline worker who's safer on the job, for the small business owner who could look with more confidence to reopening. We can't let the sacrifices we've made over the holidays and over the last 10 months go to waste. This afternoon, I'll be speaking with local business owners in BC and PEI who are working hard to keep employees on the payroll. Later, I'll also have a chance to drop in on a virtual classroom with students in Edmonton. As a former teacher, these classroom meetings are among my favorites. Our kids are doing an incredible job of not just adapting, but also looking out for each other. So to all the kids doing virtual school this year, and with a lot of you starting up this week, you're doing great. Keep it up. And remember, even as you're trying to figure out how to get virtual school going, this is tough for your parents too. So maybe give them an extra hug at the end of the day and maybe for once do the dishes without being prompted or asked to it. We're all in this together, and the more we can all help each other out, the better we're going to make it through this. Right across the country, people of every age are doing their part. Now is not the time to give up. With rising cases, many provinces that have already made tough decisions will have to continue doing so, whether with local restrictions or province-wide shutdowns. It's not easy, but it is necessary. Our government will be there as a partner for all orders of government as they make the right choices to keep people safe. Working together is what will get us through this crisis, because we're not out of the woods yet. On New Year's Eve, there were over 8,400 new COVID-19 cases reported in Canada. And the day before, there had been almost 7,500 cases. These aren't just numbers. Hundreds of families are grieving someone they lost over the holidays. Thousands more are worried about a loved one in hospital. Countless paramedics, nurses, and doctors are struggling to keep up with new patient after new patient. That's what's at stake here. That's why your choices matter. En portant un masque, en gardant vos distances et en évitant
By
les
wearing a mask,
rassemblements,
physical distancing, and avoiding social gatherings, you are keeping yourself and others safe. By using the COVID alert application, you can contribute to slowing the spread of the illness. For example, Last Thursday, hundreds of people entered their unique code into the application after receiving a positive test result. That simple action will help prevent hundreds of other people from catching the virus. The struggle against COVID-19 is something we need to do as a team, and we will get through this pandemic. Over the last few weeks, our government has provided additional support to the communities that needed it. For example, the Red Cross in long-term care in Quebec and the Canadian Rangers in the Quanishit First Nation. And we are ready to do more if necessary.
Especially in Ontario, long-term care homes are facing extremely concerning outbreaks of COVID-19. This is unacceptable. Our elders, our parents and grandparents built this country. They raised us, and they deserve the very best possible care. We've already lost too many elders in long-term care. The tragedies of the spring must not be repeated. So as we have been since March, our government is here to support provinces in getting the situation under control in their jurisdictions. Already, we've been in touch with the Government of Ontario and stand ready to provide additional targeted help. Today, just like when we first deployed the armed forces and the Red Cross during the first wave, our top priority is keeping people safe. I'll be bringing up long-term care homes with all premiers on Thursday at our First Minister's meeting, as well as shared work on vaccine distribution and measures on borders and travel. We're all in this fight together, and our government will always be here to do our part. An armed forces deployment, boosting testing, isolation measures, this can be the difference between local outbreaks becoming a crisis or becoming under control. I think of when the Shamattawa First Nation in Manitoba requested emergency support to respond to the COVID-19 outbreak in their community over the past weeks. The federal government deployed the Canadian Armed Forces, who worked side by side with the community on testing, contact tracing, and isolation capacity. And today, cases are a fraction of where they were, and the community continues to work hard to stop the spread of the virus.
To all those working hard on the ground, whether in the Canadian Armed Forces or the Red Cross, in a hospital or community organization, thank you. You are doing incredible work. We will continue to be there for you. In the weeks and months to come, our government will continue to help those who need it. 2021 will be better than 2020, I promise. But it will still be difficult. Together, we will get through it. Happy New Year,
everyone, to all of us.
Thank you, Prime Minister. Merci, Monsieur le Premier ministre. On va commencer la période de questions aujourd'hui avec le téléphone, avec une question, une sous-question. Opérateur, c'est à vous.
Thank you. Merci. Première question, Louis Blouin, Radio-Canada. À vous.
Bonjour, M. Trudeau, bonne année. Il y a un
Question.
sondage léger ce matin qui montre que 48% des Canadiens
Happy New
qui
Year.
ont visité de la famille, des amis, qui
A
vivent
poll
en
this
dehors
morning
de leur
showed
domicile pendant les
that
fêtes. On voit que les
48%
cas augmentent,
of Canadians
les décès
visited
augmentent.
family
Il y a
outside their
Québec
town
qui
over the
change
holidays.
mesures,
Cases are
risque
rising.
de confinement, un possible couvre-feu. Est-ce
Now,
que c'est le
Quebec's
bon moment?
considered
Ou est-ce que c'est le
harsher
moment
lockdown
pour un
measures,
traitement choc,
even a
selon vous, en ce moment?
curfew. Do you believe that this is the right time for that? And even some kind of circuit breaker? Answer. Throughout this pandemic, we have supported the provinces in the difficult choices they must make, and we will continue to do so. I know that that's not what people want to hear. The fact that we're going to have to keep following the rules and undergoing stricter lockdowns in different parts of the country. But since we are at the beginning of the end now with the vaccine coming, this is the time when we need to work harder, be very careful, and recognize that even though cases are continually increasing, we will be able to get through this pandemic if we do the right thing. The federal government will be there to support the provinces as we have been doing since the beginning.
En sous-question, Monsieur Blouin?
d'accord avec ces nouvelles restrictions? Est-ce qu'elles sont inévitables au fond?
Question.
Sur la loi sur les mesures d'urgence, est-ce
When
que
it comes to the Emergency Act, the Emergencies Act, my question is whether the federal government is considering national
On est
measures.
toujours en train de regarder
Answer.
tous les outils qu'on a pour aider, pour
We are
protéger
always
les
looking at
Canadiens,
all the
mais,
tools we have to
comme
protect
j'ai dit,
Canadians.
on voit
But,
réellement
as
à
I have
travers
said,
le pays, différents
throughout
enjeux,
the country, there are different kinds of issues and situations. Local, provincial, and territorial governments are reacting to these different situations. They're doing the right thing, and I'm not at all interested in imposing the Federal Emergencies Act. Instead, I'm more interested in supporting the provinces and doing the right thing throughout the country.
I think we've seen from the very beginning that we always need to look at all different tools that we have to keep Canadians safe. But like I've said from the beginning, I'm not particularly keen on using the Federal Emergencies Act. I think on a practical basis, the challenges faced in different regions are very different, and one-size-fits-all approach from the federal government isn't automatically the best thing, far from it. And on the other side, we've been working extremely well with the provinces across the country as they've moved forward on the right measures for them. We will continue to work closely with them. I look forward to my First Ministers meeting, the First Ministers meeting of 2021 on Thursday. And we'll talk about all these issues and how we continue to work together on what is right everywhere across the country.
Thank you. Operator, next question on the phone.
Thank you. Merci. Next question, Christy Kirkup, The Globe and Mail. Line open.
Hi, good morning, Prime Minister. Many Canadians are watching other countries roll out vaccines faster, and they're asking why that is the case. And so I'm wondering, what is your explanation to Canadians about the speed of Canada's distribution plan, and what can be done by levels of government to expedite this? We're learning about vaccines, for example, that are sitting in freezers and are not being rolled out to those who need them the most.
I think all Canadians, including me, are frustrated to see vaccines in freezers and not in people's arms. That's why we're going to continue working closely with the provinces, both to deliver vaccines to the provinces and to support them as they need it in terms of getting more vaccines out to vulnerable populations and frontline workers as quickly as possible. We've been able to ramp up over the past number of weeks in terms of vaccine delivery, but now is the time with the new year upon us to really accelerate, and that's certainly what I'll be talking with the premiers about on Thursday, how the federal government can support and help in getting these vaccines even more quickly out to Canadians. Je sais qu'il y a une impatience.
Repeated in French. I know that Canadians are impatient, and I am too. Canadians are impatient when it comes to seeing the most vulnerable vaccinated as quickly as possible. We don't want to see vaccines in freezers. We want to see them in the arms of vulnerable Canadians. And I will be speaking with the provinces and territories on Thursday to see what the federal government can do to continue helping the provinces vaccinate Canadians as quickly as possible. The vaccination programs have been going on for a few weeks now, and now we really need to speed up to ensure that we are protecting the highest possible number of people as quickly as possible. The federal government will be there to help.
And just on another matter, Prime Minister, why did the federal government delay, again, new regulations designed to lower the price of drugs in Canada while facing concerns from industry over how the rules would impact vaccine access?
I think everyone understands that right now our priority is keeping Canadians safe as possible, getting vaccines to Canadians, keeping them safe with cutting-edge treatments, and we're going to focus on making sure we're helping Canadians as quickly and as efficiently as possible and working with industry on making sure that happens.
Thank you. Operator, one last question on the phone.
Thank you. Merci. Prochaine question. Émilie Bergeron, Agence QMI. À vous.
Bonjour, Monsieur Trudeau. Vous avez réitéré votre
Question.
intention de bloquer l'accès à la prestation
Mr. Trudeau,
de maladie
you have stated
pour ceux,
that
qui
you
ont
will
obéi les
block access to
recommandations
the
et
Canada
qui sont
Recovery
allés dans le
Sickness
sud.
benefit
Vous dites que vous
to those who have
partagez
traveled over the holidays
l'indignation,
and are now in
des
quarantine.
gens, face à ça.
You have said that you
Mais
share
comment avez-vous
Canadians'
l'intention de
indignation about
procéder
this.
et est-ce qu'un projet de loi va être
What are you intending to
nécessaire
do?
pour faire les
Will
changements?
legislation be tabled?
D'abord, il faut se souvenir,
Answer.
ça sert à quoi cette prestation de maladie?
Well, it's very
Si
important to
quelqu'un
remember
se
what the
retrouve au
purpose
travail,
of this
tout à
sickness
coup,
benefit is. If
commence à
someone
avoir
is at
des
work
symptômes
and starts
de la
getting COVID
COVID-19,
symptoms,
on ne voulait absolument
well,
pas
we
que cette
really
personne
wanted to avoid having
décide
that
de
person
devoir rester au
decide to
travail
stay
malgré
at
leurs
work
symptômes,
even
parce
though they
qu'ils
have
n'avaient
these
pas d'autre
symptoms,
manière de payer
because that's
l'épicerie
the
pour leurs
only
enfants.
way to pay the
Elle est
bills
là
and feed
pour
their
aider
kids.
les gens pour pouvoir
So this benefit is there to help
protéger
people.
leurs
It's to
collègues au
help
travail
people
et
protect
les
their
Canadiens
coworkers
avec
and
qui ils rentrent en
Canadians in
contact.
general.
Elle a été créée pour ça et elle a eu
That's what
l'appui
this benefit was
unanime
designed
des
for.
partis à la Chambre des communes
And
parce
it was
qu'on
unanimously
savait que c'était
supported
une
by
mesure
parties
importante.
in the House of Commons
Évidemment, il y a
because we knew that it was
personne
an
qui
important measure.
s'imaginait que ça
Now,
aurait pu être utilisé
at the time,
par des
nobody
gens qui
dreamt of the
font fi des
idea that
recommandations de
it
la santé
could be
publique
used by
et
people
utilisent
who were
pour
ignoring
payer
public
leur
health
quarantaine
recommendations,
au retour
people
de
who were
vacances
simply
dans le Sud, quand
trying to
la
use
grande
that money
majorité
to pay
des
for
gens
their quarantine
comprennent
when they
que
get back
c'est
from
pas le
traveling
temps de faire
abroad.
ça. Donc,
When
c'est
most Canadians
absolument
understand perfectly well
inacceptable
that
et
this
on
is
est en
not
train
the
de
time to be
travailler
traveling like that.
sur
So,
des
of course, we
manières de
agree that it's
s'assurer
completely
que
unacceptable.
ce ne soit pas disponible
And
pour
we
les
are
gens
working
qui
hard to
reviennent
make
de
sure that this
vacances ou de
benefit is not
voyages non
available for
essentiels.
those who are returning from
On va
non-essential
avoir plus
travel.
à dire dans les jours à venir, mais
We
je
will
peux
be
vous
giving
assurer
more
que j'ai
information on
demandé
how
au
we are
ministre
moving
de
forward in the
travailler
days to come,
avec
but I
acharnement
can assure you that we
là-dessus.
were working very hard on this.
I think we need to remember what the Canada Sickness Benefit is for. We brought it in place to ensure that if someone comes down with a sniffle or symptoms of COVID-19, they don't decide, oh no, if I stay home, I don't get sick benefits and I'm not going to be able to pay for groceries for my kids. We want them to stay home and we want them to have the support. That's why we brought in the Canada Sickness Benefit. We didn't bring it in and we didn't imagine when we passed it unanimously in the House with the support of all parties that people would use it to pay for their quarantines after having gone south for a 2-week vacation. So that is something we are going to fix right now. We're looking at ways of doing it. I've asked the ministers responsible to come up with solutions rapidly to ensure that it is there to keep Canadians safe and protect people who need this sickness benefit to stay away from work, not as a way of paying for quarantine after a vacation.
En suivi, Émilie?
Oui, bien sûr. Sur les mesures de contrôle
Question.
que le fédéral peut mettre en place
When
dans
it comes
les
to
aéroports,
the federal
bien
government's
durant la première vague
control
de
measures in
COVID-19,
airports,
vous avez été beaucoup critiqué à ce sujet-là.
during the first
La
wave
Ville
of
de Montréal
COVID-19,
avait
the federal
envoyé,
government was
ses
criticized
propres,
for its measures on that score.
professionnels de la santé, pour
The city of
rappeler
Montreal
la
had sent its
quarantaine,
own health professionals
obligatoire.
to check in
C'était
on
vraiment
mandatory
important.
quarantine.
Maintenant qu'on est en deuxième vague,
Now
au
that
plus
we're in the
fort de
second
la
wave,
deuxième vague, est-ce que vous
at
pouvez
the
en faire
perhaps the
plus?
peak of the
Et
second
je veux
wave,
savoir si vous considérez
I'm wondering
suspendre les
whether
vols en provenance de l'Afrique du
I'm
Sud
wondering
dans
whether
le
the Canadian government is thinking of doing more and suspending
D'abord,
flights from South Africa.
ça fait depuis le mois de mars
Answer.
qu'on a amené une mesure
First of all,
plus forte que
since March,
bien d'autres pays
we've
autour
brought
du
in
monde.
measures that were
Presque tous nos
stricter than
collègues
many other
que vous
countries
aviez
around the
n'ont pas
world.
ces mesures-là,
Many other
c'est-à-dire un
countries that
confinement
are our allies
obligatoire
don't
de
have
2
that,
semaines
which
pour
is
quiconque
a
rentre au
mandatory
pays.
2-week
Cette
quarantine for
quarantaine
everyone coming into the
obligatoire,
country.
c'est une mesure qui a été extrêmement
This mandatory
efficace.
quarantine has
Même
been
maintenant,
extremely
on voit que,
effective.
des cas de transmission de la COVID-19
We see
basés sur
that
les
COVID-19
contacts
transmission
étrangers ou des
due
voyageurs
to travelers from
représente moins
abroad
de 2%
represent less than
des
2%
nouveaux cas de
of new
COVID-19.
cases
Alors,
of
c'est une
COVID-19.
mesure qui fonctionne très
This
bien.
measure is
Au
working
fil
very
des
well
derniers
then.
mois, on a augmenté
Over the
les
last few
mesures de
months,
contrôle. Il y a maintenant
we have
presque 5 000
increased
appels
measures.
en moyenne par
There are
jour
now
qui
on
se
average
font pour
5,000
faire des
calls
suivis
every day
sur les gens en
to follow
quarantaine, et
up
on
on
est
people
toujours
who
en
are
train de
in
regarder des
quarantine.
façons de renforcer ces mesures-là,
And we are always looking for ways to strengthen those measures,
particulièrement avec ce risque de travailleurs qui reviennent du Sud et de l'étranger.
especially given that there's this
Nous
risk
avons
of people
aussi,
returning from holidays
pris des
abroad.
mesures pour que, à partir
We have also taken
plus tard
measures
cette semaine,
to
quiconque
ensure that starting
retournera
later
au
this week,
Canada va
whoever
devoir
comes back to
démontrer
Canada
un
needs
test
to show
négatif,
that
de
they have a
COVID-19
negative
pris dans les 3
COVID-19
derniers
test
jours.
in the last 3
C'est
days.
une mesure de plus pour s'assurer
That's yet another measure to ensure that people are protected, in addition to the rigorous measures that we have already put into place. We will continue to see what we can do to further protect Canadians. That is our highest priority, whether it be limiting direct flights from the UK or other countries. We will always take decisions based on protecting Canadians.
Since the month of March, we moved forward with a mandatory 2-week quarantine for anyone entering the country. That is something that is stronger than measures put in place by most of our allies, but it has been extremely effective. Because of that 2-week quarantine period that has been strongly enforced over the past many months, we've seen cases of transmission linked to external or foreign travel being less than 2% of all active cases. But we know and we are happy to do even more. On top of enhancing the follow-ups and measures on quarantine, we're seeing about 5,000 calls a day made on ensuring quarantines are being respected. We're going to be increasing those measures as well. But we're also, as of later this week, demanding that anyone returning to Canada demonstrate a negative COVID-19 test taken before takeoff that will reassure us even further that we are keeping our borders safe. In regards to flight restrictions, we will continue to monitor what our allies are doing, what the science is saying. The concerns around various variants around the world are real, and we will continue to do whatever it takes to keep Canadians safe.
Hi, Prime Minister. Kevin Gallagher, CTV National News. I understand that when it comes to helping the provinces speed up the rollout of vaccines, you're saying the Emergency Measures Act is out. A lot of nurses are being told right now, when they're asking about why aren't more doses getting into people's arms instead of sitting in freezers, that, well, the provinces got those vaccines earlier. As you remember, those early doses. So at that time, did there need to be some more federal support to help ramp up this giant vaccination project?
We have been working closely with the provinces since the month of May on preparing for eventual vaccines rollouts. The National Operations Center, the Major General Fortin, who's been working tirelessly on ensuring distribution of vaccines, is ongoing. The benefits of having received hundreds of thousands of doses before we expected them in the end of December has allowed us to ramp up our vaccination programs quicker. We have seen some challenges that I think we're all impatient about in terms of getting those vaccines into arms, but we are confident and very hopeful that over the coming weeks, the challenges will be overcome. And the federal government will continue to work closely with the provinces on ensuring that we're able to get these vaccines out to the most vulnerable and to our frontline workers as quickly as possible. There are many other ways of doing it other than just through hospital centers, and these are things that we're working with and exploring with the provinces on.
You mentioned today that no one should be taking a vacation, but obviously there's 2 members of your caucus who did leave the country. Many other politicians, there's been lots of stories about it, of course, left the country despite this advice that you've been giving consistently. What does that do, in a sense, to the basic public health messaging the government officials are trying to get out?
One of the things that has been really, really important throughout this pandemic for Canadians is the sense that we are all in this together. That we're looking out for each other, because the actions of any one person can have a positive or a negative benefit on the health situation of your neighbor. And this sense of solidarity we've seen throughout this country has been, quite frankly, really inspiring. And continuing to demonstrate that we are there for each other, that we are supporting each other, is extremely important. It's been tough. It's been a long year for everyone, and you know, we need to continue to do our very, very best in supporting them. That's why I was disappointed to find of two of our caucus members who traveled and why there were consequences in them resigning from their committee roles. And that's why all Canadians were so disappointed to see so many examples of folks who should have known better doing things that put us all at risk.
Hi, Prime Minister. Olivia Stepanovich, CBC News. Are you worried manufacturers may slow down deliveries if they see vaccines unused or going to waste in Canada? Is the slow vaccination rate making it hard to lobby for speedy or earlier deliveries? If you can answer in English and French, please.
Let me be very clear, first of all, there is no concern about vaccines going to waste. We have extremely strong measures in place to ensure that the vaccines are properly supported, properly stored, but obviously, for many different reasons, we want to get those vaccines into the arms of vulnerable people as quickly as possible. And that's what we're very much focused on. We will continue to work to accelerate the process safely and to vaccinate as many vulnerable Canadians as possible, as quickly as possible. Not because we're worried about what companies might say, but because we want more and more Canadians to be kept safe every single day. Although the conversations continue with companies around increasing the access to early doses and accelerating the delivery of vaccines in Canada, I am certain that as we work out the challenges currently seen in certain provinces, we will be able to demonstrate that we are doing very well in terms of vaccinating Canadians. And for that, the federal government will be there to support the provinces in working out these challenges and vaccinating people quickly. Je pense que c'est extrêmement important de comprendre que
it's very important to remember that we have protocols in place and logistics that are very rigorous. So we are not concerned that vaccines will go to waste. But we do, of course, want to speed up the process of vaccine delivery as quickly as possible so the vaccines can get to vulnerable Canadians. We will continue working with the provinces in order to ensure that vaccines are delivered as quickly as possible. We will continue to work with the various companies to ensure that vaccines are delivered safely and effectively as quickly as possible. And I will be focusing on that when I speak with the provinces on Thursday.
Do you think it's still possible that the majority of Canadians can be vaccinated by the fall? In English and French, please.
Yes, I'm confident that we're going to be able to get vaccines to every Canadian who wants them by September. That is certainly our goal, and we are very much on track towards that.
Repeated in French. I believe that it's crucial to be able to vaccinate all Canadians who want the shot by September, and that continues to be our objective.
Good afternoon, Prime Minister. Mike Blanchfield, Canadian Press. I want to ask you about the politicians traveling. How harmful is all of this political travel to convincing pandemic-fatigued Canadians to listen to politicians now, to follow this advice?
I think Canadians have been making sacrifices on a personal level, on a professional level, on family levels over the past many, many months. And as leaders, we've been encouraging and exhorting Canadians to continue to do the right thing. So it is unfortunate to see a number of politicians not take their own advice. I understand and share the frustration that many Canadians are feeling who would have loved to have a little break from all this, but who know that it is not the time to do that. That in order to get through this, we need to continue to be there for each other. We need to follow public health rules. And that's exactly what we're going to continue to focus on doing. Okay. Je pense que
repeated in French. Canadians know how important it is to keep making sacrifices, limiting contacts, and getting through the pandemic thanks to these sacrifices in order to be able to reach the end of the pandemic as quickly as possible. It's very important to follow public health rules. And that's why it's so disappointing to see people who should have known better, who nonetheless chose to travel
Nous avons une position de responsabilité envers les Canadiens.
We are in a position of responsibility towards Canadians as politicians. We are responsible for serving Canadians and acting as models, and that is why it is so disappointing to see people making judgment errors.
Tomorrow, Prime Minister, are you planning to extend it? And with all these new worrying variants of the coronavirus popping up in multiple countries, are you considering wider bans?
We already have some of the strongest travel measures in Canada since the month of March. Travel to non-Canadians or non-permanent residents has been banned to Canada. We have a 2-week quarantine that is rigidly enforced that many of our allied countries don't have. We also are bringing in further measures around a negative test before someone can now return to Canada. We will continue to look at measures that will keep Canadians safe. We're evaluating the UK ban that is currently in place and seeing whether and how it might be extended, whether it needs to be extended. We will be guided by science and best practices on this, but every step of the way, we will do what is necessary to keep Canadians safe.
David Aiken, Global News. Happy New Year, Prime Minister. I want to think about snowbirds for a second, or seniors in any event. We've learned of a number of them who are traveling to the United States, not for vacation. They want to go get the vaccine there. They think that they'll have a better chance there. Can you speak to this group, to the risks of seniors going to the United States? Can they count on Canada to help them if they need to be repatriated, if hospitals overflow in the U.S.? Can you talk about that issue?
The Government of Canada recommends against any non-essential travel. It is safer for people to stay at home in Canada. We are delivering vaccines to the most vulnerable, and we have access to a wider range of potential vaccines and more vaccines per capita than just about any other country. I understand that people are still looking at travel, but we discourage it strongly. There will not be any mass repatriation efforts like we had in March if people are stuck overseas in this time of crisis. This is why we are saying to stay in Canada and stay safe.
Thank you. C'est ce qui m'a fait la conférence de presse d'aujourd'hui.
Merci tout le monde. Bonne journée.
Service gouvernemental de téléconférence. For service...
Veuillez patienter, un agent sera avec vous sous peu.
Thank you for waiting. Bonjour, pourrais-je avoir votre numéro de réservation de conférence, s'il vous plaît?
Oui, bonjour. Mon nom, c'est Jacques. Je suis le technicien pour la conférence. Le numéro, c'est 162 2050.
Parfait. Alors, donnez-moi quelques instants. Je vous transfère immédiatement à la préconférence et serai avec vous sous peu.
Parfait, merci.
Bonjour, Monsieur Jacques.
Oui, Pierre va prendre l'appel pour faire les tests avec vous. Merci.
Bon, ben c'est bien parfait, merci.
Oui, bonjour, opératrice pour la téléconférence.
Oui, bonjour, Monsieur Coogan, ça va bien?
Ça va très bien et vous?
Oui, ça va bien, merci. Alors, mon nom est Grace et je suis l'agente dédiée pour votre appel aujourd'hui.
Très bien. En même temps que je vous parle, je vais tester les micros, mais ça fait plusieurs fois qu'on se parle, hein. Vous savez comment ça fonctionne?
Oui, il n'y a pas d'introduction. Est-ce que vous voulez qu'on donne les instructions pour les participants pour poser des questions?
Oui,
Pas du tout.
oui, vous pouvez, mais gardez votre discours le plus court, s'il vous plaît.
C'est bien parfait. Et aussi, je crois qu'on va prendre 3 questions dans la salle et 3 sur le téléphone, c'est bien ça?
On va commencer avec le téléphone, et puis il y aura une modératrice ici dans la salle là, qui se dirigera vers vous lorsqu'on sera prêt à prendre des questions dans la salle, au téléphone, puis ensuite, effectivement, on se dirigera dans la salle.
Excellent. Et pour la qualité du son, j'ai un peu d'écho quand que je parle, je m'entends, mais je sais pas.
Parfait. On va ajuster le volume. On va ajuster le volume en même temps qu'on se parle.
Bon, ben, c'est bien parfait, M. Coogan. Et aussi, je voudrais confirmer que nous enregistrons l'appel aujourd'hui.
Oui, si c'est ce qu'on vous avait demandé, oui.
Oui.
Et puis, patientez, peut-être que je vous donnerai le heads-up pour lorsque vous pourrez transférer les gens avec le son ambiant de la salle.
Bon, ben, c'est bien parfait. Alors, j'attends votre heads-up.
Très bien, puis je vais tester un dernier micro. Est-ce que vous m'entendez bien ici aussi?
Je vous entends très bien.
Très bien, merci beaucoup Grace, puis on se parle très bientôt.
Parfait.
Bonjour Monsieur LeBlanc, ici Pierre à Ottawa qui vous parle. Est-ce que vous nous entendez bien?
Oui, je vous entends bien. Est-ce que vous m'entendez bien?
Oui, on vous entend très bien de notre côté aussi. Vous êtes déjà dans la salle de presse. Est-ce que vous pourriez quand même dire juste quelques mots pour qu'on puisse ajuster votre volume?
Absolument. Alors, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Très bien. Bon, bah, c'est très bien. Ça marche très bien de notre côté. Donc, je vous donnerai un petit heads-up lorsqu'on sera prêt à commencer. Ça, je pense qu'on... Parfait. 30 secondes.
Merci beaucoup.
Grace, pour la téléconférence, vous pouvez transférer tous les appels avec le son ambiant de la salle, s'il vous plaît.
Excellent. Merci.
Cette conférence est actuellement enregistrée.
Bonjour à tous. Merci de vous joindre à nous pour cette conférence de presse. Hello, everyone. Thank you for joining us for this press conference. I will send it off to Minister LeBlanc.
So, bon après-midi tout le monde. Good afternoon et bonne année. Happy New Year. Today, I am joined in Ottawa by Dr. Tam, Dr. New, and Major General Fortin. I want to start by thanking Canadians who stayed home and gave up their usual holiday celebrations. I know the sacrifices Canadians are making. It's so very important now, as it always has been, that we listen to local public health authorities. Wear a mask, get tested if you have symptoms, and maintain a proper social distance. As the Prime Minister said a few moments ago, we can be optimistic. We have 2 approved vaccines to fight COVID-19. In just a few weeks, our government has delivered almost 500,000 doses of these vaccines to provinces and territories, and General Fortin in a few minutes can give more details about the hundreds of thousands of doses on their way over the coming days and weeks. We are on track to vaccinate every Canadian that wants a vaccine by September. But we cannot let our guard down now. Now is clearly not the time to travel. Let me be also very clear. The Canada Recovery Sickness Benefit, it is not intended for travelers who are quarantining after a holiday. On a dit aux Canadiens depuis mars.
Since March, we have asked Canadians to avoid non-essential travel. And we will continue to repeat that message. I would also like to speak about the Canada Recovery Sickness Benefit. My message to those who have traveled, as the Prime Minister just said, is very clear. Those who have traveled abroad will not access this benefit. It was not designed for you. Its goal is simple: to provide workers paid sick leave when they don't have sick leave from their employer.
Canadians want us to do this together for each other and for our country. So I would now like to invite Dr. Tam to say a few words.
Bonjour à toutes et à tous. Bonne année 2021. There have been 611,424 cases of COVID-19 in Canada, including 16,074 deaths. Nationally, there are almost 77,500 active cases across the country, and the average case count is at close to 7,500 new cases reported daily over the past week. The number of people experiencing severe illness continues to increase. And over the past 7 days, there were an average of over 4,000 individuals with COVID-19 being treated in Canadian hospitals, including 770 in critical care, and an average of 122 deaths were reported each day. Canada is also monitoring the emergence of COVID-19 virus variants that appear to be associated with an increased risk of spread. To date in Canada, there have been 9 cases of a variant virus first reported in the United Kingdom, and no reports of other variants of concern, including a variant first reported in South Africa. While there is a lot to look forward to as 2021 begins, we must also proceed with a full understanding of the difficult task ahead. 2 weeks ago, Canada had just exceeded 500,000 cases of COVID-19. Now, with the current momentum of the epidemic and continued high rates of infection in many areas of the country, the 5 months it took to reach our first 100,000 cases is now shortened to just over 2 weeks for the latest 100,000 cases of increase. This ever more rapid accumulation of cases will continue until we can make significant progress in interrupting spread, which is why we must all continue our efforts. Our main task this year is to stay the course with public health practices as the rollout of safe and effective COVID-19 vaccines proceeds across Canada and around the world. We have learned a lot about how to limit the spread of COVID-19 over the past year, with ample evidence to show that early, strong, and sustained public health measures are key to controlling the spread of COVID-19. And we know that whatever the combination of measures and restrictions, there is one vital factor underlying their success, and that is us. When it comes to stopping the spread of this virus, public health measures are only as effective as our collective efforts and resolve to see things through. The behavior and choices made by each and every one of us matter a great deal. As our access to safe and effective vaccine expands, let's resolve to continue supporting each other. 2020 was an unbelievably difficult year, but Canadians have made remarkable achievements all along the way, as individuals, as a country, and as part of the world united against COVID-19. To be sure, there will be challenges ahead, but we have shown that we have the strength and resilience to continue through this next chapter and see things through for a more hopeful 2021. Let's not forget the things that we've experienced, learned, and rediscovered that will be important to hold on to as we go forwards. Among them, the memories of those we've lost and a renewed understanding that none of us can have health unless all of us are cared for and supported. Thank you.
Merci. Bonjour à tous et à toutes et bonne année. Il y a eu 611 424 cas de
Welcome.
COVID-19 au
Happy
Canada,
New Year.
dont 16
There have been 6,424 cases of COVID-19 in Canada, including 16,074 deaths. Nationally, there are almost 77,500 active cases across the country, and the average case count is at close to 7,500 new cases being reported daily over the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 4,000 individuals with COVID-19 being treated in Canadian hospitals, including over 770 in critical care, and an average of 122 deaths were reported each day. Canada is also monitoring the emergence of COVID-19 virus variants that appear to be associated with an increased risk of spread. To date in Canada, there have been 9 cases of a variant virus first reported in the UK, and no reports of other variants of concern, including a variant first reported in South Africa. While there is a lot to look forward to as 2021 begins, we must also proceed with a full understanding of the difficult task ahead. 2 weeks ago, Canada had just exceeded 500,000 cases of COVID-19. Now, with the current momentum of the epidemic and continued high rates of infection in many areas of the country, the 5 months it took to reach our first 100,000 cases has now shortened to just over 2 weeks for the latest 100,000 case increase. This ever more rapid accumulation of cases will continue until we can make significant progress in interrupting spread. This is why we must all continue our efforts. Our main task this year is to stay the course with public health practices as the rollout of safe and effective COVID-19 vaccines proceeds across Canada and around the world. We have learned a lot about how to limit the spread of COVID-19 over the past year, with ample evidence to show that early, strong, and sustained public health measures are key for controlling the spread of COVID-19. And we know that whatever the combination of measures and restrictions, there is one vital factor underlying their success, and that is us. When it comes to stopping the spread of this virus, public health measures are only as effective as our collective efforts and resolve to see things through. The behavior and choices made by each and every one of us matter a great deal. As our access to safe and effective vaccines expands, and we stand at the beginning of the end of this pandemic, let's resolve to continue supporting each other. 2020 was an unbelievably difficult year, but Canadians have made remarkable achievements all along the way. As individuals, as a country, and as part of the world united against COVID-19. To be sure, there will be challenges ahead, but we have shown that we have the strength and resilience to continue through this next chapter and see things through for a more hopeful 2021. Let's not forget the things we've experienced, learned, and rediscovered that will be important to hold on to as we go forward. Among them, the memories of those we've lost, and a renewed understanding that none of us can have health unless all of us are cared for and supported. Thank you.
Merci, Dr. New. Et à vous, le général Fortin.
Merci, Monsieur le Ministre. Bonjour et bonne et heureuse année à tous.
Thank you, Minister. Hello,
I'm happy to start
and
the new
Happy
year
New
by
Year.
saying that the deliveries of both December allocations of both Pfizer, BioNTech, and Moderna are now complete. A total of 424,050 doses of vaccines were delivered across the country. Out of those doses, 20,400 of the Moderna vaccine have been delivered to the territories and represent the first very much needed doses for Canada's northern communities. Canada has proven that we're ready for a sustained tempo of vaccine deliveries expected throughout the month of January. This week's shipment of 124,800 Pfizer-BioNTech vaccines is on the way. We expect a further 208,000 doses per week for the rest of this month. We're also expecting 171,000 doses of Moderna the week of January 11. We are working diligently with manufacturers and federal, provincial, territorial, and Indigenous partners to ensure a continuous and predictable flow of vaccines. We're on track to have over 1.2 million doses of Pfizer, BioNTech, and Moderna delivered by end of January. To facilitate this distribution of this growing number of doses in remote and isolated communities in the coming weeks, we continue to acquire and deliver enabling equipment and supplies to enhance the cold chain capacity and flexibility across the nation and to enable onward distribution to more sites across the country. I want to reaffirm to all Canadians that while quantities seem limited, we are scaling up. This is a deliberate operation. We are closely coordinating with provincial and territorial partners, stakeholders, and different other partners every day to ensure that the delivery process of COVID-19 vaccines continues to operate smoothly and in a safe and efficient manner to all Canadians. Alors, je suis heureux de commencer une nouvelle année en annonçant que les livraisons du vaccin Pfizer, BioNTech et Moderna
I am pleased to start a new year by announcing that the deliveries of the December allocations of Pfizer, BioNTech, and Moderna vaccines are now complete. A total of 424,050 doses of vaccines have been delivered to the provinces and territories. Out of those, 20,400 doses of the Moderna vaccine have been delivered to the territories. These are the first much-needed doses for Canada's northern communities. Canada is ready for a sustained tempo of vaccine deliveries expected throughout the month of January. This week's shipment of 124,800 Pfizer BioNTech vaccines is on the way. We expect a further 208,000 doses per week for the following 3 weeks. We are also expecting 170,000 doses of Moderna vaccine the week of January 11th. The Government of Canada is working diligently with manufacturers and federal, provincial, territorial, and Indigenous partners to ensure a continuous and predictable flow of vaccines. We are on track to have approximately 1.2 million doses of the Pfizer, BioNTech, and Moderna vaccines delivered by the end of January. To facilitate the distribution of this growing number of doses in remote and isolated communities in the coming weeks, we continue to acquire and deliver enabling equipment and supplies to enhance cold chain capacity and flexibility across the country and to enable onward distribution to more sites. I want to reaffirm to all Canadians that though numbers are still limited, we are scaling up vaccine supply and delivery. We are taking deliberate action and closely coordinating with provinces and territories, stakeholders and partners every day to ensure that the delivery process for COVID-19 vaccines continues to operate smoothly and in a safe and efficient manner throughout 2021. Thank you.
Merci beaucoup, Général Fortin. Alors, nous prenons maintenant les questions. À vous, Corinne.
Bonjour, merci à tous. Nous allons commencer avec les questions au téléphone pour 3 questions avec une question de suivi chacun, puis nous reviendrons dans la salle. We will start on the phones for 3 questions, 1 follow-up question each, and then we will come back to the room. Operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Sharon Kirky from National Post. Please go ahead, à vous la parole.
Hi, Dr. Tam. Thanks for taking my question. You said there are now 9 confirmed cases of the UK variant in Canada. But I'm wondering, how closely are we looking for it? Are we testing just a small sample from people who've been to the UK, or are we doing random sampling?
Thank you for the question. So Canada has been doing genomic sequencing of viruses throughout the pandemic period, and we've been sequencing as a background rate as about 5% of the cases to date, but accelerating that to the background sort of analysis, if you like. At the same time, of course, we've been broadly going out to the provinces and territories clinical networks, laboratories to take into account travel related cases, but also other areas, I think, of target, whether they be specific patient groups such as the immunocompromised. Of course, as vaccines are rolling out, we want to know if any cases are occurring in persons who got the vaccine. Those are some of the samples that we need to target as well. But also, I think, as you said, that there's some sort of background surveillance samples that also needs to be analyzed as well. So it's a bit like a sort of three-pronged approach to the genetic sequencing.
And sorry, my follow-up. This variant overtook the circulating strain within like 3 months in England, and it's now in Canada. My questions are, how quickly could it potentially overtake the circulating strain here? And what is our plan to try and reduce transmission? And, you know, and what this might potentially mean for us in the coming months if this variant does overtake the circulating strain?
Yeah, so to date, the cases that we know of that's been genomically identified have been in travelers or their contacts. Provinces are looking at contact tracing, but as far as we know, we're not expecting that there's large numbers of contacts related to these cases. And partly, of course, is a result of the fact that we have quarantine measures in place, including the 14-day quarantine. But, you know, there's always a risk of a virus that can transmit in all sorts of hidden ways to accelerate in different places. So the public health measures and the core public health measures in reducing contacts to reduce spread remains the same. However, you've really got to double down on your efforts with a more transmissible virus. So, you know, getting increased, you know, uptake and observations and compliance with these measures become really important if you're dealing with such a high variant. And as you've seen in the UK, if it does accelerate spread, it means that there will be more public health measures that might be needed. So it would become a sort of difficult situation. I'll just have to add that we actually, you know, the whole world is sort of looking for these variants, but there may be some other countries that don't have the capacity to detect these variants. So again, the broad-based measures of quarantine and the broader measures that we have in place are there for a reason, but the community public health measures are really important if you're going to stop rapid spread.
Merci. Prochaine question.
Thank you. Merci. The next question is from. La prochaine question est de Hélène Bugetti de Le Devoir. Please go ahead. À vous la parole.
Yes, hi. My first question is actually for Dr. Tam. We see that some provinces or some regions of the country are delaying the second dose of the vaccine in order to vaccinate more people. Yet Pfizer has said that they don't really know the efficiency of their vaccine after 3 weeks after the first dose. So I'd like to know, what do you think of that idea of postponing the second dose?
Right. This is a topic of course, active discussion. And we're also going back to the National Advisory Committee on Immunizations to ask for some of their advice, looking at what we do or do not know, as well as the key considerations if people are looking at that interval. All I would like to really strongly emphasize is that Canada is committed to a 2-dose vaccine regimen. And so it's not about not giving 2 doses. And we'll certainly be keeping an eye on all manner of data available. There's some limited data on vaccine effectiveness after that first dose, which we will also sort of analyze separately. But that data looks, while it does look promising, it's just very limited at this time. So the concept is a 2-dose regimen. I do think that it comes down to vaccine management and making adjustments in the face of constrained supplies. So initially, of course, given what the supply situation and the uncertainties in December, people were holding back that sort of second dose. Now, I think, as Major General Fortin has indicated, with a bit more certainty in the supply, I think provinces are looking towards not holding back that second dose because they want to more rapidly immunize the population with that first dose. And it may depend on the epidemiologic situation. So the Atlantic provinces may not be in the same situation as maybe Quebec, for instance. So I think the provinces and territories are trying to manage that. But you know, that the commitment is a two-dose regime.
So you don't disapprove, if I get it correctly. Monsieur Leblanc, j'aurais une question à vous poser concernant la prestation pour
Mr. LeBlanc,
la maladie. Donc,
a question regarding the sickness benefit. Could you tell us exactly what will be done to end this loophole and what will be done to punish violators? And what about the situation of those who have spent time with someone infected when they were at an illegal party? What will be done for that kind of situation if people become infected in that circumstance? Answer. The Prime Minister has been clear. We will prevent those who have taken non-essential trips from accessing the Canada Recovery Sickness Benefit. That benefit was not designed to compensate someone who has shown a lack of judgment and who has not respected clear public health guidelines by traveling, especially with non-essential travel. The Prime Minister was very clear. In the coming days, we will have precise details about how we will prevent people in that situation from accessing the benefit. It's very clear that the goal of this benefit was never to apply to people in that situation, and we will ensure that they cannot access it. We also need to remember that the goal here that has been laid out by provincial authorities and health authorities is that people who have to quarantine, like you said, because their partner or someone in their household has COVID or is in preventive isolation, if these people don't have sickness benefits from their employer, if they're part-time workers or freelancers, if they don't have any way to access sickness benefits, we want to ensure that those individuals will do the right thing, stay home, respect public health guidelines. We want to avoid having them have economic pressures to go back to work even if they have symptoms. We want to avoid having them go against public health guidelines. We want to ensure that this important public health measure remain in place, but we don't want people who have shown a lapse in judgment by traveling abroad to be able to abuse access to this benefit, and they will not be able to access it.
Merci. Prochaine question.
Thank you. Merci. The next question is from. La prochaine question est de Catherine Lévesque de la Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. Bonne année. Monsieur Leblanc, j'aimerais
Question.
dans la même lignée.
Happy New Year.
Tout à fait répondu à la question de ma collègue.
Mr. LeBlanc, I didn't hear an answer to my colleague's question about how you will go about ensuring that travelers can access this benefit. Will there be legislation? Will this have to wait until Parliament returns, or can you act earlier? The Prime Minister has been very clear. We will prevent people who have traveled from accessing the benefit. This was a bill that was adopted unanimously in the House of Commons in September. All opposition parties unanimously supported this measure with the appropriate goal of ensuring that people who are exposed to COVID-19, people who should be in lockdown, to enable them to do that. It never occurred to anyone to grant that benefit to those who had been traveling outside Canada for non-essential purposes. In the next few days, we will provide details on how we will ensure that people in that situation can't access the benefit. But as the Prime Minister said, we have a clear plan to prevent people from accessing that benefit if they are not entitled to it, and we will put that into place as soon as possible.
Le premier moment, ce serait apprécié. Et ma question suivie, c'est sur en fait, les vaccins.
Follow-up question regarding the vaccine. What will you be saying to the provinces on Thursday to help them vaccinate the population? Answer. Once again, the Prime Minister confirmed that on Thursday there will be a meeting with provincial and territorial premiers, and we will discuss the matter of vaccines and how the provinces can increase the number of vaccines delivered. As General Fortin said, we will be looking into how hundreds of thousands of further doses that will be arriving in the coming weeks. Throughout January, we're going to have many more vaccine doses arriving in Canada. And we will be delivering that to the provinces as planned. So it's a matter of seeing how the federal government can better support the provinces so they can support their population, vaccinate their population more quickly. And we will also be sending the provinces all sorts of necessary equipment in order to increase the vaccination capacity in each province. For example, family doctors throughout the country have offered provincial authorities who have offered to participate in the vaccine delivery measures. I believe that each and every province and territory is actively looking for ways to increase the rate of vaccine delivery. And as we have done from the beginning, the Canadian federal government will be there to support the provinces.
Nous allons revenir dans la salle pour 3 questions. We are coming back to the room for 3 questions.
Hi, Tonda McCharles with the Toronto Star. Minister LeBlanc, could you speak to, as I understand it, the negative COVID test requirement applies only to airline travelers returning. And I wonder if or how or will you apply the same requirement on land border crossers? And would, for example, essential travelers, which I guess they still cross the border, are they exempt from that requirement? I imagine there aren't a lot of land border crossers that aren't deemed essential. However, there are some who have been given exemptions in the past. So is the requirement applying to them, and how will it work for essential workers?
Well, thank you, Tonda, for the question. And you're absolutely right. My colleague Mark Garneau announced that at 12:01 a.m. On January 7th, there will be a requirement for airline passengers arriving in Canada to have a negative COVID test in place 72 hours before the departure. We have been working with airlines and other authorities to ensure that those measures are in place. It's an important additional protection for Canadians. It's something that other countries have had in place as well. It in no means is designed to replace the very important quarantine measures, the 14-day strict quarantine measures for international travelers. Dr. Tam and others have spoken about how that is the best practice in terms of reducing or eliminating the chance of an onward transmission for somebody who may arrive in Canada and have COVID-19. We have said that the 72-hour pre-arrival testing requirement will start with airline passengers. And as we said, it comes into effect this week. We haven't decided yet in terms of land or border crossings, land crossings. As you noted, the vast majority of people arriving at land borders are essential travelers, truck drivers, others fulfilling important essential activities for the Canadian economy, and including for the health and safety of Canadians. But we're open to looking always at additional measures that would provide additional layers of protection. But we're starting aggressively and deliberately with international air travelers who arrive in Canada, but we'll continue to work with health authorities and others if they have suggestions about ways that we could further enhance those measures, including perhaps at some point the question of land borders.
Dr. Tam, I don't know if you want to add anything to that. If you do, please do so. I'll just outline my second question, and if you want to weigh in on that point, thank you. Major Fortin, I just want to understand, so the concern that a lot of people have been expressing, including the Prime Minister, around the slow vaccine rollout in many provinces is not just that it's not getting into people's arms, but perhaps it might act as a deterrent in our efforts to get swifter and more volume from vaccine companies if they see they're stuck in freezers. So have you got that? Do you share that concern? Have you heard anything about that? Have any companies expressed sort of a hesitation that Canada can't manage the volume it's got, so why would we send them any more?
Well, thank you, Donda. So I have not heard any such comment from manufacturers at this stage. What I would say is this: provinces and territories are scaling up their capacity to immunize. I think it's very important to know that as you get more reliable data on the transportability of vaccines, that helps transport or onward movement for the last mile to the point where people will where vaccine will be administered. That will make it easier for provinces and territories. Secondly, as you get more predictability on shipments, you can align the health workforce. You can align certain locations to be ready to receive, and so on and so forth. So now that we're in a better position to predict with confidence what we're going to receive in January, and in the coming days we'll be able to I guess confirm what we're receiving in the first weeks of February, and so on and so forth. That will help align all those resources. Furthermore, we will be, over the next few weeks, we'll continue to ship cold chain enabling equipment that will further bolster the capacity in the provinces and territories and provide them an ability to create additional vaccine distribution sites. So all of that put together really will facilitate the different jurisdictions to administer vaccines effectively and as safely as possible. Oh, freezers, the thermal shippers, the Credo cubes of different types, the countertop, the standing freezers, the dual temp, the single temp. I have a long list, but let me assure you that we're tracking that very closely with the different manufacturers and the providers of those equipment. Some has been, quite a bit of equipment has been distributed already to provinces and territories, and more to come in the coming weeks.
Hi there, Mackenzie Gray with CTV News. Dr. Tam, there's reports out of the UK that 1 in every 50 citizens there has the new variant of COVID-19. How important do you think it will be for Canada to extend border restrictions to keep that from coming out? And in a similar vein for Minister LeBlanc, today the Prime Minister urged Canadians to not travel internationally. But like many things the federal government has urged Canadians to do during the pandemic, many people are not listening, including a number of politicians. This is something that is solely in the federal government's jurisdiction. Why is the federal government, if you believe so strongly that Canadians should not travel internationally, why are there not stricter regulations in place to make sure that Canadians cannot do so at this point in time?
Well, so perhaps I'll start with the second part of that question, and then Dr. Tam or others in Ottawa may want to add. We've said consistently that it was unrecommended. Public health authorities nationally and provincially have, since the beginning of the pandemic, advised against foreign travel, non-essential foreign travel. It is a global pandemic, which means if you decide to go on holidays in the Caribbean or in Mexico or somewhere else, you're not actually escaping the pandemic. You're acting in a way that's irresponsible and doesn't follow the best public health advice that has been available publicly for many, many months. So our government has added additional measures, for example, the requirement for a negative PCR COVID test before being allowed to board a flight coming back to Canada. That measure, which is coming into effect at 12:01 a.m. On January 7th this week. We're always looking at other measures that would better protect Canadians. We've said from the beginning of the pandemic that we are constantly reviewing the measures that are in place to see if we can add additional layers of protection. There is a misnomer circulating that somehow the government of Canada can legislate against travel outside the country. If you look around the world at countries that have requirements for exit visas, I'm not sure we want to be on the list of those countries. But any measure that tells Canadians that non-essential travel internationally should not be undertaken is something that we're prepared to look at. We can't be more clear. And I think Canadians themselves, we've seen expressed over the last number of days, particularly, some of the most compelling testimony came from frontline healthcare workers who are carrying an enormous responsibility across the country to protect all of us. And they have seen, and they are expressing very clearly, a totally understandable frustration at Canadians that might disregard the public health advice and undertake non-essential foreign travel. So we totally understand that very, very reasonable frustration of Canadians. And we're going to continue to take every measure necessary to ensure that that practice doesn't continue.
So I'll just add to that response by saying that I think right now and the next months are going to be really difficult in Canada. So, reducing any risks of importation and escalation of the pandemic in Canada is really important. As you've seen, mutations of the virus can occur all the time, and these variants of concern that have mutations where we are worried, whether it's increased transmissibility or other features, can actually come up in different areas of the world, not just the UK. So these broad recommendations of avoiding non-essential travel is really critical. I mean, Canadians, everyone needs to observe that. And when they come back, of course, the quarantine measures needs to be respected. We're going to do as much as we can to beef up looking at our enforcement measures, if you like. The travelers from the UK, as well as those from South Africa, for now will still be picked out of the lineup, if you like, as they enter Canada with questions on those pick machines. And they will be given additional scrutiny by the public, our quarantine officers. They will require soon, of course, the pre-departure testing to be put in place. But we will be, looking at them from the perspective of additional quarantine oversight. But this can pop up anywhere, which is why it's really important to maintain these broad measures and not just one country at a time. The other thing just to add is that if you're in the UK, they're now in their highest level of lockdown. So their advice is that no one goes out of that country for anything but essential and sanctioned travel as well.
one of the things that we heard from provinces in terms of why they're not able to roll the vaccine out quick enough is that potentially they don't have enough staff. We've heard from retired nurses and other former health professionals saying, hey, I can help, put me in. Is that something that you expect that will happen later in the pandemic? And Minister LeBlanc, also on the vaccine rollout, you said yesterday that we expect it to be efficient. Clearly right now, the rollout has not been efficient. Outside of procuring more vaccines, what specifically will the federal government do to make sure the provinces can get the vaccines out quicker than they've done right now?
So you asked 2 or 3 questions in the same question. I'll answer the second part of your question, then Dr. Tam can also add something. The Prime Minister has said that we have convened a meeting of First Ministers, all the premiers, on Thursday, late afternoon, a couple of days from now. One of the items we want to discuss with them is the issue of vaccine rollout. Major General Fortin and his colleagues at the Public Health Agency have done an extraordinary job in terms of the logistics of delivering hundreds of thousands of vaccines in record time and with extraordinary care to provincial sites determined by the provinces and territories. And they're going to continue to do so. As General Fortin indicated, we're also providing a whole series of supplies necessary for the safe vaccination of Canadians and supplies necessary to properly hold vaccines while they're rolled out in provinces and territories. So the Government of Canada has done, I think, a very, very good job of helping provinces prepare for the vaccines, not to mention, obviously, the fact that we've procured and paid for these millions of vaccines that will, as the General said, be ramping up very significantly over the coming weeks. So the conversation on Thursday night with First Ministers will be, how can we work together to ensure that there is no unnecessary lag time in those vaccines once they're delivered to provinces and territories at sites that the provinces and territories have determined that those vaccines are promptly distributed to the appropriate population. So the Government of Canada stands ready, as we have from the very beginning, to do whatever we can to assist provinces and territories. But the vaccination of their populations is properly a provincial responsibility, and our job is to do everything we can to support them in discharging that responsibility as expeditiously and safely, obviously, as they can.
Thank you. Sorry.
Actually, don't have much more to add. I'm not sure whether there is an actual human resource issue at the provincial level, because there's, of course, they have a lot of experience in deploying vaccines, including the seasonal influenza vaccine. And we've heard many health professionals coming forward to say, we can help. I think partly is, as Major General Fortin has indicated, that some of the complexity of the cold chain of the initial vaccines needed to be worked out. And there's more instructions or guidance from the manufacturers as they are coming out and allowing the further transportation of the vaccines, then more and more people can help. But as you've seen, the provinces are rolling things out a bit differently in terms of how they construct the clinics, etc. So we'll certainly be providing support if needed. I know that we have the Canadian Red Cross and others, on tap, as it were, if there's any additional support that's required as well.
Thank you. So we have about 5 minutes left, so we will take one last question in the room.
Hi, Happy New Year, everyone. David Thurton, CBC News. I'm just wondering if you could tell us what reports have you been receiving, doctors or Major General Fortin, about the wastage of vaccines? And is this wastage that you're seeing, if you are getting any reports, is it out of the ordinary? Or is it more than what you might have expected?
I personally haven't heard of any wastage in vaccines. I'm not sure what the definition is of. Can you be a bit more precise?
Yeah, well, we're seeing reports out of Alberta and Manitoba that there are some doses left in vials, and because of the storage requirements or the strict requirements around these vaccines, that last dose in that vial has not been able to be used because, I don't know, maybe they ran out of people to vaccinate and, for the allotted period of time. And so they've had to basically throw away those last doses in those vials. So we're seeing definitely reports in Manitoba that they've seen some wastage. The Alberta Health Services has also had to respond to some reports as well as that. So I'm just wondering, at the federal level, have you received any reports of vaccine wastage, and is it out of the ordinary?
I don't know of any reports that's been forwarded to us in terms of vaccine wastage. I think just prior to the Christmas period, we've heard that from a regulatory and other from the manufacturers that you can, if there's actual enough for another dose from the 5-dose vial, you could use that. There may be other reasons why all the dose is not used. As you said, it could be at the end of the day, there's some scheduling issue that they couldn't schedule a lot of people, at the same time. I don't know anything about that, so I think that would have to go back to the provinces. But yes, there is, in the 5-dose vial, we've been advised that if you can get an absolute full dose out of it, you can use it.
Just as a follow-up, what advice, what recommendations are you giving to the provinces who might be encountering this issue already, or as the vaccine, more vaccines arrive, they might have said, hey, we have enough vaccines for, 50 people today, but only 48 show up, and there's 2 doses left in the vial. What is your recommendation to the provinces to maximize and to make sure that every ounce, every drop is being used?
Well, I think we have at the working level a vaccine supply working group that is, and the Canadian Immunization Committee that is sharing all the best practices that people need to do. And that's really in the provincial jurisdiction of rollout and planning of the clinics. But I'm sure there's lots of best practices that people can have. Yes, there may be specific characteristics of these vaccines, which means you can't just sort of put them back in the fridge and then keep using it. But I think those kind of data will increase as we're going along from the manufacturer as well in terms of the flexibility. But I think, vaccine clinic planning, of course, is important. But that's really not sort of in our federal jurisdictions, but we're very happy to facilitate any best practices amongst the jurisdictions.
Bonjour, merci à tous. Thank you, everyone. This puts an end to today's press conference.